If you have the type of dizziness where it feels like you're just constantly on a boat out to sea, then this video is for you. So normally I do about 1 or 2 consultations per year on this form of vestibular disorder, but in the past few months I've done about 5 consultations on people with a condition called mild debarquement syndrome. Many people could get a short-term form of this condition when you spent a lot of time on a boat, like you're being on a cruise ship or on a fishing boat for a long time. Just the passive rocking and swaying of the boat can get embedded into your nervous system for hours or days, and that's fairly normal. But for a subset of people, they could actually develop this condition that lasts a month or more, and that's when we call it MDDS, or mild debarquement syndrome. So with that being said, here are 5 things that you should know about MDDS. 1. You don't have to be on a boat to get this condition. One of the ways people will attempt to diagnose this condition is by asking in their history if they had spent some time on a boat prior to developing these symptoms. But there are many instances published in the literature where someone could develop MDDS from being on a plane or being on a train for long periods of time. So the fact that you weren't on a boat shouldn't be a reason why MDDS should be excluded. Number 2, one of the most defining features of MDDS is you will experience this constant swaying, rocking motion, but as soon as you're in a car and you're driving passively in a car, your symptoms will be completely gone during the duration of the car ride. Then as soon as the car stops and you get back moving again, then the symptoms will hit again. This part of the patient history is probably the most well-defined feature of MDDS that makes it quite unique compared to almost all the other types of equilibrium disorders. Number 3, there are rehab protocols for treating MDDS. So the ones that you see pictured over here involve something called optokinetic stimulation, as well as this movement of the head. It used to be called the DIE protocol. The DIE protocol was developed out of NYU, and many people with MDDS have traveled to NYU to get this type of treatment protocol. The problem is, anywhere from 25 to 40% of patients don't really respond to the treatment or actually get a little bit worse. 4. MDDS is thought to heavily be involved with VOR adaptation, which they suspect is being mediated by a part of the brain called your cerebellum. Particularly this part called the vestibulocerebellum, which has a lot of influence on the vestibular nucleus, which probably helps to integrate a lot of signals that affect our perception of vestibular movement. There have been some studies looking at the use of transcranial magnetic stimulation applied to the cerebellum and to the prefrontal cortex as a possible treatment strategy for complex cases of MDDS. 5. MDDS has a really strong limbic and really strong autonomic component, which means people can feel very distressed from these symptoms, and it can also have consequences that affect other important self-regulation aspects of your nervous system. Functional neurology is well suited to treat an MDDS patient because it's not about protocols, but it's really looking at the whole brain and how this is interacting to cause these types of problems for patients.